Hey there, Dr. Jason Lichten from Central Ohio Plastic Surgery, coming to you with 5 things you want to know about breast augmentation. Number 1, there are multiple different implant types you can have, be it saline or silicone, textured or smooth, smooth cell, shaped, round. These are things that are all specific based on what your goals are from breast augmentation. The most common implants used in the United States are smooth, round silicone implants, but there are times we use the others, and that's something you find out in consultation specifically for you and your body what would be the best option for you. Number 2, there's multiple different incisions you can go to put an implant in. They can go underneath the breast, under the nipple, and then people will also talk about using the armpit or the belly button. For me, for my patients, 99 times out of 100, we're going to use the incision underneath in the fold, which can be combined with a breast lift. But the reason is, I think this is the most direct access, the best hidden incision in clothes in a bathing suit. Um, it will not be visible at all, as opposed to the armpit is a visible incision in a bikini. Um, the armpit and the nipple also have more glandular tissue, so there's some worry about what that means long term in terms of capsular contracture. And also gives the best control of the inframammary crease when we go directly through the inframammary crease. Number 3, a breast augmentation augments what's there. It makes some differences in the breast potentially more noticeable. So if the breasts hang low, augmentation sometimes augments that look. If the nipples feel like they're out to the side, augmentation can augment that look. There are ways to get around that some, but a lot of times it will involve a second operation at the same time, or second procedure at the same time, to do a breast lift or reshaping. Um, Number 4, this is not a quick, I can go back to work tomorrow recovery. A lot of people talk about it as if it's a pretty easy operation. You see extreme makeover shows and everyone's great in half an hour. Well, that's not reality. There is going to be some downtime. I'm going to give you about 6 weeks where you don't want you to lift anything heavier than a gallon of milk or 10 pounds. Nothing's going to engage your pec muscle because most of the time those implants are going beneath the pec muscle, and therefore we want that pocket to settle and you to heal to end up with the best possible result. So if you're going to have a breast augmentation, make sure you've got some downtime, you've got help with taking care of kids or work so that you can get the best possible result. And number 5 is breast augmentation is probably the one procedure that is combined most often with other procedures, be it tummy tuck, liposuction, breast lift, um, liposuction of the neck, arms, arm skin, skin across the back. It can be combined with multiple different operations, so you get everything sort of done at once um, to do that sort of mommy makeover approach and combine the breasts in terms of balancing with the rest of your body. For this and more information, go to my website, ohioplastic.com, or call the office at 740-653-5064 for this, for more information, or to schedule an appointment, and we will see you soon.